Hello, fellow classmates. I'm sure most of you right now could really care less about this presentation and care more about what you're going to wear to graduation and your post-party festivities. Nonetheless, sit back and enjoy the following role play on narrative therapy with the Jones family. It's time to meet the Joneses. Brian is the identified patient. 13-year-old with ADHD has been bullied and is having problems at school. His mother, Sharon, 42, is the birth mother, and her partner, Lindsay. They have been civil union partners since 1998. They are arguing over medication and what to do with Brian. They have come to a session with Dr. von Halzenberg to start narrative therapy. Session 1 is the problem-saturated story. The problem-saturated story refers to the person's stories that individuals express, which are based on their experiences. The person's not the problem, the family's not the problem's the problem. All right. Well, I first want to thank you guys for taking the time to meet with me. Now we've gotten through the consents and got our contract signed. I'm going to kind of go over the therapy that we're going to use. It's called narrative therapy, and really what we're going to look at is defining the problem and kind of looking at the internal as how each person's internalizing the problem. And one of the things I'm going to do is I'm going to take notes and understand that when I'm done, you guys have full access to these notes. You'll get to see everything. I don't want you to think that I'm writing anything about you or that I'm saying anything, and that's something we'll do at the end of the session. But it's that way I can remember things and kind of look for points to work forward. So, and one of the things we may also do is as we're exploring this story and we define the problem, we're going to name the problem likely, okay? So just something to think about, so that way we can externalize it as we move forward. So let's do introductions and kind of as we go through kind of what your thoughts are, what your sense of the problem is. Does anyone want to go first?
Oh yeah, I can. I can totally name the problem. It was last week, we got a call. I think maybe this is the third, fourth time that Brian's been suspended for fighting at school. I don't know, I mean, I'm halfway across the country, I'm driving, I can't be dealing with this stuff, so Brian needs to get his act together.
Okay. So you're a truck driver and you got to be away a lot, okay.
Yeah, so I can't be getting phone calls while I'm driving, and
right.
There's nothing I can do about that while driving.
That's got to be tough too.
Yeah, sure is.
Is that one of them monster drinks?
Yep.
She gets them for him all the time, and she wonders why he's out of control.
He's only had like one this month.
That's not true.
That's true.
Cool. All right, who would like to go next?
I can go. Brian has ADHD, and so it is difficult for him to focus. And he's a great boy, and he's not going to be on meds because that just changes kids, and I don't want my Brian to change because he's a great kid and he knows what to do, and that's what's hard is the school just doesn't get it, and the school thinks that he's the bad guy and that he's the one doing all the bad things, but in reality he can't control
I
it.
told you it wasn't even my fault with the kid who
I know.
who I got in trouble.
I know.
We're just talking about the problem right now, and Sharon, it sounds like
And I think the problem is that you don't take responsibility for your actions and you always blame other people for it.
Well, one of the reasons that we're using narrative therapy is because it really focuses on the fact that Sharon, you're not the problem, Lindsay, you're not the problem, Brian, you're not the problem. The problem is the problem, right? It's not the family, it's not the individuals, it's this problem. And that's what later on we're going to likely define and give it a name. So let's just stick with each person's perception of the story. So is there anything else you'd like to add?
Yeah, because of this problem, the ADHD, he gets bullied a lot and he gets picked on so much. And what is he supposed to do if some kid's talking about him and how he can't be friends with anybody? He needs to stand up for himself, and he's a good boy.
Brian, how do you feel? I mean, is that how it's happening at school?
Yeah, I mean, I think lately I've just been like all over the place. Like I can't focus in class. Like I get picked on a lot for that. I get picked on a lot for having two moms. I get picked on, just constantly. Teachers don't like me.
Do the kids call you names or anything like that?
Yeah, they call me Tweak from South Park.
Okay.
I kind of go crazy sometimes. And then they make fun of me for having two moms again, stuff I don't want to share here probably.
I got you. That's tough. I mean, it's you know, it's cool that you have two very loving mothers, but I understand that
But
there's
it's,
stigma
yeah,
to
and it's
that.
also like I feel like I'm always in trouble and disappointing them, so that's kind of frustrating because they are good parents, and I don't know, it's been tough.
It's not you. Again, like we said, there's this problem that's causing it, not Brian. So again, something we're going to work through. So it's nice that you guys matched today. All right. So Brian, you told me a little bit about the problem with the bullying, but just tell me what what your sense of the problem is.
Well, I mean, I understand like what I have is like, making me kind of act out or making me not focus, and how she doesn't want me on meds, and I get that, but it's like it's hard, like just dealing with it by myself.
Have you been on meds before?
No.
Okay. All right. All right. Cool. Anything else you guys think is important as we're exploring the problem?
Well, I think, yeah, like you mentioned, we haven't tried the meds. Clearly the ADHD is the problem, so why don't we give that a shot, and maybe we can see if that would help.
Well, but we have tried other things too. There are some things, alternative ways to deal with ADHD. We've tried changing his diet and not including some of those things that do tend to make him go more crazy, like rock stars and other things like that. But we've also, and massaging him helps too. And every once in a while that'll help calm him down and really like get him focused again.
So you're into holistic health, or
Absolutely, yes.
Okay.
Yeah.
All right. So
and
you
it works.
Okay.
I
Brian.
don't think it works though if he still has ADHD, so just saying.
Okay. Well, let's go through this and look at kind of what the problem is. It sounds one of the issues is that
I really like your bracelets. Those are cool.
Thank you very much. One of the things what I'm seeing is that there's some stigma related to your relationship that Brian's enduring in school, but more so just the behavior, not being able to sit still, and this ADHD, nebulous thing that surrounds it, and the problem, the behaviors associated with it. So in our next session, and I'm going to be meeting with Brian individually, but we're going to name this problem, right? We're going to come up with something that kind of makes it its own entity, okay? So start thinking about
Spazzalot. Mr.
What?
Spazzalot, that's what I want to call it.
Mr. Spazzalot?
Yeah, like,
I like it. I think it's rad. Let's call it Mr. Spazzalot. Is that an agreement?
Sure.
Can do
Okay.
that.
Again, the goal is to externalize the problem from the family and the individual, and focus on how we can focus on the family and the individual separate from the problem. And then from there, we'll see what happens. So let's go through my notes, and you can see everything I said, so that way we can move forward, and we'll schedule the second session. Cool? Cool. Cool. All right, Brian, this is where you sign in blood.